Oncologist Dr. Roger Kwong joins us today from Gundersen Health System to talk to us about how they are using the body's own immune system to fight cancer. And it's called immunotherapy. But you know, it's not a new idea, is it?
No, it's a concept that's been around for 100 years, but it's only in the recent years that we've actually had the tools and the technology to pull it off.
Okay, so now not only do you have the technology and the knowledge to pull it off, but it seems like there really is a need for it too. So why immunotherapy?
Well, the hope has always been that the body could use its own system, and there's some cancers that seemingly respond better in some people, and we've always wondered why, the immune system being one. And now we have agents that can stimulate the body's own response, can add to that response, or in the case of the skin cancer melanoma, it's an agent that stops the blocking of the body's response. And it's thought to be more normal and natural, but it's still very toxic. When interferon first came out, it was discovered that perhaps the side effects were from a cold that we have, the malaise, the fever, and so forth, were caused by the virus, but it may actually be our body's response by producing interferon that's causing those symptoms.
Okay, now, so you did mention this, that as far as boosting the immune system, that's something a patient may need help with. And you're talking about the boosting their immune system is using a specific drug that can have some side effects.
Right. And this particular drug blocks a site. So it's an antibody that attaches to the site that is inhibiting the cells from having an action.
Okay.
And so by blocking that inhibition, so double negative, it then has the positive results of treating the disease.
And you have had some patients here who have been trying this. What have the results been so far?
Well, this is the first drug that's approved by the FDA that's actually improved survival. It's only by about 4 months in people with metastatic disease, but we're now looking at using it earlier in people who are at high risk before that cancer, the melanoma, has shown up again, and hoping that that will happen. All of this has been come about by clinical trials where patients have entered the trials and be willing to be tested against normal treatments or old treatments to see which is better.
All right, well, we'll have to have you back again sometime just to talk about where you are, maybe a year or two from now once again, since this is in such the early stages as well.
Yeah.
Dr. Kwong, thanks so much for joining us.